Welcome. We are here for Engaging Patients of the Future panel, and I'm going to keep the introductions brief. We have moderator Matt from DLA Piper, and we have two great panelists. Shawn is from Safeway Health, and for those of you who are wondering what Safeway is doing on this panel, Safeway for the last several years has been able to control and not just keep flat but reduce the healthcare cost of their employees when the national healthcare costs have been rising 8% and above. And now Safeway has created a division, Safeway Health, where Shawn, as the VP of Sales and Business Development, is teaching other self-insured employers on how they can deliver similar results. And next, we have John Mattison from Kaiser. He is the CMIO of Kaiser, Southern California. And there, he led the deployment of the largest EHR in the United States. He's also an advisor to the X Prize for healthcare. And within Kaiser, he sponsors and leads several innovations in digital health. And he also mentors dozens of startups with Rock Health and elsewhere. And without much further ado, it's all yours.
Thank you, Praveen. So, Shawn, why don't we start with you? We've heard from panelists today already to talk about where VCs are investing, and there's a lot of money pouring into healthcare, especially we've seen it in the past year, 2 years, 3 years. You've been doing this for much longer than that and have had tremendous success at Safeway. Kind of counterintuitive that Safeway would be a leader in driving successful outcomes in patient engagement and efficiency in the provision of healthcare. So talk a little bit about how you got involved in that and some of the successes that you've had.
Sure. So back in about 2005, Safeway's healthcare bill was equal to their after-tax income, and so they decided it was no longer sustainable and they needed to change things. So they actually took two people who knew nothing about healthcare but knew about consumer strategy and reorganization and asked them to fix it. Steve Bird asked them to fix it. And what they came up with was some really unique and somewhat disruptive models for healthcare. We've been able to, as Matt indicated, keep our costs flat, and then last year we were at a minus 9% medical cost trend. And on top of all of that, we've been able to engage and educate our patients. But some of the things that we've done that we've now sell B2B through Safeway Health, which is a startup. We started in about 2010. And what is our disruptive model around pharmacy therapeutic equivalency products that we sell to large self-insured employers, as well as consulting around how to implement outcomes-based incentives. But the other thing that we do is go out and look in the market for the most innovative types of healthcare startups, entrepreneurs who are looking to create a disruptive model that have a solution that seeks to just cure more than one ill, if you will, that seeks to really do something in the marketplace that is sustainable.
Okay, so John, your title at Kaiser, right, is the Chief Medical Information Officer, but we talked for a few minutes beforehand, and it sounded like maybe you wanted to be the Chief Provocateur. And talk a little bit about what your role is at Kaiser these days and how you are trying to get folks out there in the world to focus on engaging people in their healthcare.
Sure, thanks. So I come from a family of serial entrepreneurs, so being a provocateur preceded my medical practice and my current role in health IT. I wanted to key off of a couple things that Ann DeGeese said in the prior panel, which I think were outstanding. The first is she's not looking for the coolest product. She's looking for a market and a business model and a passion. And there's something I call the MMQ that I look for, and that's what I call the Missionary to Mercenary Quotient of how much innovators are really looking to change the world and put a positive dent in the universe. And one of the things that I've observed is that all these niche solutions that people are working on by themselves don't really move the needle that much. And what we really need is a behavioral symphony of wellness that includes behavioral cues from multiple sources, from devices, from the community, from healthcare, working with devices and the community and big data. But it's not as simple as the killer app. And I like to think of Daniel Kraft's talk in terms of what I call the healthcare ecosystem. And there's exponentiality occurring in just dozens of different technology domains. And it's the convergence and bringing together multiple exponential technologies together into a behavioral symphony of wellness is really going to move the needle. So in healthcare, there's a big dialogue right now moving from a doctor-centric view to a patient-centric view, and even one step further to a consumer-centric view. Well, that means someone is basically represented by their wallet. And I prefer to think of it as a person-centric view of health and even broader community-centric view of health. So if any of you haven't read the book Connected by Christakis and Fowler, I highly recommend it because it illustrates very scientifically, very credibly, how our health is so deeply influenced by the social communities that we live within. And so one of my roles as a senior advisor to the X Prize is to see that there are some very, very radically cool new technologies that exploit the technology ecosystem and the exponentiality coming to market. We started off with 300 contestants. We're down to 30. We'll be 10 in September, and we're going to give the 3 prizes about this time next year. One of the things that we're doing with one of the founders and board members of the X Prize is looking at a new model of early investment in the prize context, and we just exposed that model in Minneapolis this last Wednesday for how to really invest in a field of entrepreneurs that are trying to solve a problem and to stimulate collaboration amongst them to try and capture some of the synergies of the healthcare ecosystem. So another really important thing is, if you haven't read the book by Daniel Pink called Drive, it talks about what motivates people. And the most important thing that motivates every one of us is really wanting to make a positive difference in the world. And that's the most powerful and sustainable motivation there is. And that gets back to Ann's earlier comments about the passion and the missionary aspect, and I encourage you to read that. Arianna Huffington just released her new book called Thrive, which just happens to be the same name as our branding campaign at Kaiser Permanente, and talks about how our attitudes and how much we smile and how much we relax and how much we're mindful and how we're mindful of our breathing influences our health and how we pace ourselves after her own experience overextending herself. If you haven't watched the 4-hour series Weight of the Nation, produced by HBO, it's free, it's online, and it talks about how the social determinants of health are more powerful influencers of our current epidemics of obesity, diabetes, heart disease, stroke, cancer, and all the things that are scientifically related to disorders of lifestyle. So I encourage you to watch that. And it really drives me towards a much bigger focus on the social determinants of health and a broader notion than consumer-centric health, but much more community-centric health. So just a couple of other quick comments. We spend about 99.995% of our time in our communities, in our jobs, in our schools, in our places of worship, and about 0.05% of our time in our clinics and our hospitals. We make our decisions around health when we're not in the healthcare system, and we need to rethink health in terms of where we are. And I like to think of the mobile phone as a stationary device, flip it upside down because it's wherever we are, and that's where it can help motivate us to make healthier decisions. So mobile social gamified apps for both disease management and wellness will have a role, but only in the larger context of a behavioral symphony for wellness. Finally, if you look at the lessons of the blue zones, where you look at places around the earth where people live long, healthy lives, without a lot of technology, by the way, there are some commonalities between them. It's healthy exercise, healthy eating, healthy sleep, and healthy social relationships. And so I like to think of this as using modern technology to restore the ancient wisdom that supports the health and happiness of people who live in these blue zones. There are a couple of initiatives right now, one by Esther Dyson called Road to Wellness, and another one by the California Endowment, to look at a community-based model of improving health. And I think the role for technology there is going to be substantial. But what we really need is an evidence-based approach for how we approach different communities. Because just like in personalized medicine, looking at the genome and the proteome and the metabolome and the exposome and the socialome, we need to look at the social determinants of individual communities, find out what those gaps are through validated survey tools, validate that those gaps are within reach of that community in terms of their leadership, their aspirations, their capacity, and their appetite for change. And once we validated that, recruit leadership within those communities to engage in a much more holistic approach to improving the health of the entire community. And so the role of mobile apps and sensors and modern technologies will be there, and Esther Dyson is very focused on how to integrate that into that whole context. But I think if you as entrepreneurs are looking for a way to the future, I think Anne DeGee's words of wisdom were profound. Solve a real problem, look at it holistically, and pursue it with all the passion you have. Thank you.
So Shawn, John's talking a lot about how, if I could, posit an analogy, right? A patient is to medicine as a person is to health, right? And so maybe we don't have the correct title for our panel here, which is engaging the patients of the future. We're really trying to engage everyone and encourage those individuals and their surrounding community to be responsible for their health care, and as a way of driving. We're back. By the way,
everybody stand up and dance now.
Okay, so Shawn, anyway, some reactions to that in terms of your experience at Safeway.
Well, I think a lot, I love what John stands for, because, a lot of what he's talking about community is something that is, definitely where it needs to begin. I happen to know Esther as well, and, we've talked to her about leveraging our stores in those communities to really deliver patient care. I think, we as a startup struggled in getting out to the market and identifying our market, and we've changed it several times. And so I would say that, really identifying your market comes as you go. It's just, it happens as you go. And, we really had to take a look at, what we were trying to achieve. Getting people to change behavior is probably one of the hardest things in the world. There was an article a while back called Change or Die, where they told 5,000 people if they didn't change their habits in the next 5 years, they'd be dead. At the end of that 5 years, only less than 10% had changed. So it is a very huge undertaking to get people to change. And so, whether it's through giving them the tools of technology or giving them the support of the community, I think all those things play a role, but it's understanding how you connect all of them. It can't just, to create a solution that addresses one problem is one thing, but how is that connected to the rest of the issue on a broader scale?
All right, and so we heard in the last panel a bias among investors towards investing behind people who had some familiarity, or at least members of the team with some familiarity with the industry. But let's take a counter view of that. Let's say that maybe the industry isn't the right place to start for these kind of answers because it requires a new way of thinking. John, I know that this is something that's near and dear to your heart.
Yeah, thanks. And first I want to say that what Shawn is doing at Safeway is really revolutionary, and Safeway really is a leader, and there is a huge role for retail to play in this behavioral symphony of wellness, and I applaud Safeway for what they're doing in that space. In terms of the question of what is the role of conventional healthcare versus the consumer-centric focus, and will the two ever meet in the middle? One of the things that I like to think about in this behavioral symphony of wellness is there needs to be a much better awareness of the opportunities that exist independently for the consumer to improve their own health. Fitbit as the archetypal example. And what are the opportunities for healthcare organizations to reach out with mobile apps that we prescribe? And so we're looking at creating an app store. We're well down that path and starting to prescribe apps that work. The problem is there isn't a good evidence basis yet for what works, and that's why I'm active on the board of OpenM Health, which I encourage any of you developing mobile apps to take a look at OpenM Health, because it's a framework for creating an evidence basis for what does or does not work in the mobile health and in the sensor space. And so to get back to the question, how do these two worlds come together? I think that the reinforcement, there's a lot of studies showing that a physician's recommendation has some durable power and lasting value, but only if the behavioral tools exist and persist outside of that office encounter. So my view is that both approaches need to occur, but they need to be much more wed and coordinated in the middle in order to create that behavioral symphony.
So what is the ideal? Give me 5 years and give me the next generation. What is the ideal in how we restructure this gigantic part of our economy so that it has a more positive, more person-centric, more community-centric, more sharing-focused orientation? Either one of you.
Well, I'll start, because how long do we have? Because that could take a while for us to discuss that in
You have 6 minutes and 24 seconds.
Okay, thank you.
Divided equally between the two of you.
Yeah, okay, got it. Now, in order for us to try to move that forward and think about the patient of the future and how do you bring this all together, I think it's really, a lot of it has to do at the core with education and having patients feel empowered to ask questions, having them empowered to understand and navigate and take ownership for their own health. I think that would, in the end, really impact outcomes, impact safety issues, and impact all other issues if patients were more informed. So what we've done is we partnered with Alterum to develop a survey and then Tonic Health to deliver it to find out how our employees, how ready are they to take control of their own health? How engaged of patients are they? How empowered do they feel? And then based on those results, we'd push custom information to them based on how they answered so that we can meet the person where they are. So personalizing it to a larger level and having them understand why it's important for them to take a role in their health, what the impacts are of that, and how to navigate the system. That's just a little piece of it, though.
And how do we build social platforms that can encourage people to do that, John?
Right, and first of all, I agree with everything Shawn's said, but in addition to that, engaging our local communities. There's an app called Nextdoor, which engages neighborhoods in social activities at the local level. There's products well known like Patients Like Me, that help individuals with similar conditions help support each other. So both the local and the digital, local physical and digital elements of social engagement are going to be very powerful. But ultimately, I think using modern technology to restore ancient wisdom comes back to a lot of what we've learned thousands of years ago about the importance of mindfulness, the various forms of meditation, the various forms of being conscious of our breathing and pacing ourselves and not burning out. And in the hyper speed of the world that we all live in technology and in Silicon Valley in particular, it's very tempting to lose sight of the end goal, and the end goal needs to be a meaningful life, and we need to be very much more mindful of our family, our friends, our immediate communities, and how we pace ourselves and how we contribute and how we focus our interests in making the world a better place by what we do, not just at home, but at work and with our peers and our colleagues. And there's an increasing body of evidence, and Arianna Huffington's book covers some of this, about how the richness and the positivity of our social interaction affects our body chemistry. And Mike Snyder of Stanford, the chair of genetics at Stanford, is doing a study. I'm one of his study subjects, looking at thousands of metabolome metrics, looking at 4 microbiomes every 3 months among his patients, and looking at the effects of stress at a physiologic level. Deepak Chopra is doing a study with Eric Schott of Mount Sinai, looking at similar things in the effects of meditation at a very, very deep physiologic and chemical level. So we're going to be rewriting the textbook of medicine. We're going to be rewriting medical education, and we're going to be rewriting what it is that motivates people to follow healthier pathways. And a lot of it, again, is using many of the innovations that you all are working on to help bring us back to be more mindful. So what I like to suggest to people is, instead of counting the number of steps they do every day with their Fitbit, use their Fitbit a little bit more mindfully. Extend the period of observation. So instead of saying my goal is 10,000 steps today and checking 3 times a day to see if you hit it or not, extend it to 30,000 steps for 3 days and then 70,000 steps for a week. And pretty soon, instead of thinking, oh, I'm 200 steps short, I got to go walk the dog, you're thinking, there's the elevator, where's the stairway? I could get in my car and go down to the store. Why don't I just walk? It's only 1.5 miles away. So we need to really restore the notion of mindfulness, and I think we can use a lot of these technologies to get there, but it gets right back to that question of what is the big picture, what are we trying to change, and how do we get there through tools that we know will work in the end to produce healthier people and healthier communities.
So that, I react to that. I think you're dead on, John. And my reaction is, boy, there's a virtual American Medical Association head shaking in this room right now. And it sounds like it's a real challenge to the traditional model for education of doctors and Western medicine. And does that matter? Do we need the buy-in of the medical community to make this work?
There are many outside the medical community who look at it and say it is so broken we just need to start from scratch. And as Vinod Khosla often reminds me, you know, major innovations always occur at the edge and directed by the consumer, but that doesn't mean that they can't be embraced by the existing enterprise. And so my view is that we need to look very differently at the kind of medical students, the kind of people we're looking for who are selected to become medical students, and we need to change medical school training in ways that are much more focused on health and prevention than they are on an organ-based disease function. And one of our next panelists sitting right in front of me, Atul Butte, is going to talk about some of his work in genomics and the whole panorama of omics, and how as we begin to understand that more and more we can mass personalize medicine. And I think it's going to frankly cause a complete rewrite of medical textbooks from an organ system approach to much more of an etiologic approach based upon the interaction of the environment and our genome, because we know our identical twins do not have identical outcomes, and the reason for that is they have different experiences, different attitudes, different interactions with their environment. They don't exercise and eat or sleep the same. And so to the extent that we begin to understand how to personalize our care to individuals based upon their genomic potential, but modified by their environmental exposure and their preferences and their behaviors and their habits, I think that we're going to have a different medical school graduate, a different set of medical practitioners, and there'll be much more collaboration and teamwork across the integrated delivery networks with social workers, mental health workers, and really beginning to address the social determinants of health. And Kaiser Permanente is well down that path in terms of sponsoring, for example, farmers markets. So one of the big problems in inner cities is the nutritional desert. So how do we make sure that we bring fresh, healthy food? How do we make sure that there are safe sidewalks to walk on, parks for the kids to play at night? All of this needs to be brought together, and this needs to reshape the medical enterprise. I think the forces are going to come from outside, but I think most people when they start off medical school start off because they want to make a positive dent in the universe, and then they get trapped in this organ system model of thinking. And I think we need to unlock that lock of very limited disease-focused thinking and re-infuse healthcare with health and wellness. And I think it's very possible, and I think all of you are going to help us drive that.
It's an excellent answer, John. Thank you. So we're out of time, but I'm going to go one last question very quickly to Shawn, to share with our entrepreneurial group who may be exploring how they can add to what you've been working on for years. If you could name one directive, one problem that you are trying to solve currently within Safeway Health, and that this group of great thinkers could help you with, what would that be?
Well, I'll tell you one problem that we are on the road to solving, but that we find is having the data and the ability to use that data effectively. And we're talking about social networks and how that impacts. We've included that in our data now that we've built. You know, who are the social influencers and where are they? So I would say data is probably our biggest issue, and how we use it and use it effectively in our company.
Well, thank you very much, both of you guys. Wonderful presentation.